Hello everyone. Today we are going to learn in this video about experimental pharmacology. These are the contents we are going to discuss in this video. Introduction. The Hahnemann, he was called as the father of experimental pharmacology because he is the first physician to prepare medicine in a specialized way by proving on healthy humans and to determine how medicines cure disease. The definition: it is the branch of pharmacology deals with the effect of drugs on living systems and can be studied on both animals and humans. The aims of experimental pharmacology: to study the mechanism of action of a potentized homeopathic drugs in animal mode, to study the site of action of a homeopathic drugs, to study the toxicity of approved drugs, to find out therapeutic agent suitable for human use, to find new, better drugs in therapeutics, to discover new, simple, better techniques for pharmacology, and for bioassay and standardization of drugs. And coming to physiological sol solution, it can be defined as an artificially prepared solution to keep an isolated tissue alive under an experimental condition. It was a Ringer who first introduced that idea that the tissue could be kept alive by providing proper nutrition, oxygen, and temperature. And the content of these solutions varies according to the tissues and animals are taken. The solution provides food materials, that is, oxygen, electrolyte, energy, in the same proportion as that present in the tissue fluid, which is almost act as a substituent to the tissue fluid. In the time of preparation, we should carefully note about the balance of cation, pH, temperature, and proper aeration. About the balance of cation, the mainly potassium and calcium are to be maintained. The solution in bath should be changed frequently because the prolonged aeration can tend to change or alter the pH. These are different physiological sol solutions. Ringer salt solution used in rabbit heart perfusion, thyroid solution used in rabbit intestine or goniapic ileum. D-Jason solution used in rat uterus, duodenum, colon experiment. Frog's Ringer solution used in frog's rectus abdominis muscle and least dorsalis preparation. Krebs Enslate solution used in the goniapic tracheal chain preparation and rabbit aortic stripe preparation. And these are some commonly used instruments in an experimental pharmacology are organ bath, atrial cannula, venous cannula, piston recorder, bulldog clamp, rat holder, and even more. Coming to effective dose and lethal dose. The effective dose is a dose that produces a desired effect in half the test population is referred to as AD50 or effective dose 50. In pharmacology is nothing but a medial dose. Coming to lethal dose is the dose of any substance tested required to kill half the number of test animals. The animals were taken usually rats and mice. There are various forms of LD50 includes by mouth, applying on skin, injecting, muscle, or by cavity. Originally, the lethal dose is denoted as DL50 because the dose is lethalis, and it was designed by British pharmacologist J.W. Trevan in 1927. Coming to Biot Transformation. This is a chemical conversion of our drugs to other compounds in the body. It's nothing but the metabolism of our body. It's usually mediated by an enzymes or occasionally non-enzymatic reaction. And it's regarded as a branch of pharmacology, but more properly it is belong to biochemistry. And it's giving a better understanding of a certain pharmacological, toxicological, and clinical findings. Even a government legislation requires the biotransformation studies. Coming to bioavailability, it is denoted as capital F. F is nothing but a fraction. Definition: the bioavailability is a measurement of the extent to which a drug reaches a systemic circulation. In pharmacology, the bioavailability is used to describe the fraction of an administered dose of an unchanged drug that reaches the systemic circulation. If we administer intravenously, the bioavailability will be in the maximum state, 100%. But when we medicated is administered via any other routes, the orally, its bioavailability will be decreased. Coming to the mechanism of action, unlike allopathic medicine, there is no proven mechanism by which homeopathic works. Many of the homeopathic medicines are more diluted than according to the non-laws of physics and chemistry. There couldn't be possible of even any effect when it reaches to 24x or 12c. These are some critics of homeopaths as they dismiss homeopathy due to the placebo effect. But as a homeopath, the more the dilution, the more the potent. It has been known that the low potency and high potency medicines contains different classes of active principles, and hence their mode of actions are also entirely different. And the Ornstein law, it is explained the properties of higher homeopathic potencies based on the phenomena of homeostasis. It's an environmental condition had been done by some people earlier. The phenomena was proposed by Southam, Ehrlich and Stebbing. They proposed that the substance which in lower dose will stimulate, moderate dose will inhibit, and the larger dose will kill the patient. And this one graphical representation of Ornstein's law that showing in a smaller dose will showing a stimulatory effect, in the larger dose or in the lethal dose showing a toxic or an inhibitory effect. Coming to some physicians and scientists, Huppe, he did a similar experiment on a bacterium, and his generalization became known as the Huppe's rule. And Roland van Wijck and Fred A.C. Began tried to explain homeopathy in the basis of homeostasis we already discussed. The Southam and Ehrlich study the effect of natural antibiotic in cedar wood that inhibit the growth of wood decaying fungi. Coming to D8 effect, the phenomena that occurs in homeopathically prepared solution offer different potencies. Studies have been shown that the relation between the amount of agents and effects is not linear. 4. They took 3 beakers, each containing a diastase enzyme. In the first beaker, they had mercury chloride crude substances. In the second beaker, they had nothing but a distilled water. The third beaker, they had a potentized medicine. In the first beaker, because of an interruption of the crude substances, they show the decreased hydrolysis. In the second beaker, because of no medicine, they are showing a normal accepted rate. In the third beaker, because of a potentized medicine, the action of medicine that shows an increased hydrolysis. If we draw a graph of an effect against potency, that shows a maximum effect at D8 potency, so that the effect is called as an D8 effect. One of the results of the D8 effect and Ornstein's law and also the high dilution is that homeopathic remedies are not dangerous to healthy people or animals. Because of this, the homeopathic remedies can be given to animals in their drinking water, and if any other animals are drinking the treated water, they would not be affected, and the same is true for human homeopathic remedies. Coming to energy storage, the theory of water memory states that when you dissolve a substance in water, it still has a memory of the substance no matter how many times you dilute the water afterwards. The water with other molecules stores energy in 4 quantized ways: translation, rotation, electric excitation, and vibration. And vibration are accepted means of storing energy in physics. The water memory was proposed by Ben Winston. Coming to Ben Winston, he published his one of journal that degranulation triggered by very dilute antiserum against IgE14 in the journal Nature. In this, in the human basophil cells, he infused highly diluted antiserum. Even for a highly diluted antiserum that shows a degranulation in basophil cells. The result shows the familiar rhythmic changes in basophil reaction as the potency is increased, a factor still unexplained even by homeopathy. And the theory of high dilution is a theory based on a new mathematical model and a quantum theory that has been put forward as an explanation to how homeopathic remedies works. They observed change in the infrared spectrum of homeopathic solutions, which should have the same infrared spectrum as water, and when analyzed with a nuclear magnetic resonance, the conical frequency was developed. The conical frequency is unique to each remedy, and the product quantifiable results. And the adverse drug reaction is an unwanted negative consequences sometimes associated with the use of medications includes side effects, withdrawal effects, etc. In homeopathy, generally there is no side effects if prescribes the potencies of 30 Ch. If you prescribe low potencies like 1x, 2x, it has some effect of minor nature but not life-threatening.